May IVF Center, Coimbatore. So I had a doubt. What are the precautions you have to take while doing septal resection before the embryo transfers?
So septal resection, every septa doesn't need resection, first of all. Septal resection, first of all, we come to a thing called diagnosis.
Yes.
And when we come to the diagnosis, we have to diagnose it by carrying out a 3D scan, but not by hysteroscopy or laparoscopy. What I follow is that for every septa, whichever I get, the septa has to be removed. I don't take a chance with it until the very small septa, 3-4 millimeter, I remove every septa. And septa have to be removed. And after removing septa, the only precaution comes is that should we put a copper T or should we put a only without copper, is put an IOD device. Some people put on oral pills so that they don't the layers they don't come together. I think there is a lot of debate about it, which is right, what is wrong. But I think so. Septal resection for an IUI I don't do. For IVF, every patient I do septal section in case. My team does. I don't do septal. I'm not an endoscopic. I'm an IVF and a neurologist. But septa should be removed in case they're more than 3 to 4 millimeter. In case of a failure patient, septa to be removed in all. But I've seen complete septas also delivering normally.
So it was diagnosed in 3D and the septa was removed 2 times. Septal resection was done in other center for 2 times. Now again we have done 3D, but small septum, the subseptate uterus, it was given like that.
Leave it.
But we tried for transfer. We didn't get the endometrium over 6.
So more you touch your septa, the more you kill the endometrium. So I am against these surgeries. You should do surgeries. If you see, when we were very young, we learn a laparoscopy by doing ovarian fulguration. In case you know the new generation, it's called ovarian diathermy. So the junior most in the department will do ovarian diathermy. PCOD ovary, kuch karta. You feel very happy that you have done a surgery, but you have killed that ovary. No, you killed that ovary. It is a contraindication nowadays. In a young girl with endometriosis, remove the whole of endometrioma, peel it off, or if you do aspiration, it won't do any help at all. Peel it off, you'll get low HC and low AMH then. Same thing with the dermoid. And same thing comes with septas. Not one, madam, I can tell you, septas done by the best of people. As I told you about my horoscope now, so many complications in my life. So I say that I have had many complications. I've seen best of surgeons, beautiful endometriums, 9 millimeter, 10 millimeters, beautiful endometriums. Small septa, they just poke and then they form full Asherman syndrome. I've seen 3 to 4 patients done by the best of people. Because we don't know how somebody will respond.
Yes,
Those people, they thought we'll take out that septa, maybe done by a junior, maybe done by anyone else, but septas can lead to lots and lots of complications. So nowadays you don't even do any biopsy. Do you remember when? Yes. I think madam will agree that when we were young in gynae, every day we were only doing endometrial dating only. Yes. Every day, you remember, ma'am? So many biopsies we were doing for endometrial for dating. But now we never touch endometrium. Never go near the endometrium. Even menstrual blood we take it from the cervix only. We never go in the. But the moment you touch endometrium, they'll develop banding, bridges, and that is called Asherman syndrome. Or they will have chronic endometritis, acute endometritis. So never touch the endometrium. So you're right, I agree, but 6 endometrium is coming after the previous 2 surgeries. Right. But now, if you do a 3D scan, are there any bridging necrosis,
So we have done a hysteroscope.
Yeah.
We have seen that bridges.
But Asherman syndrome. So
तो
एशरमन आ गया ना, उसके बाद क्या है, फिर बिल बनाओ, हम PRP कर देंगे, हम स्टेम सेल डालेंगे, and then we don't leave the patient. It is not recommended.
जैसे मेरे पास एक लड़की आई थी, उसको कंप्लीट सेप्टम था, तो वो आई थिंक वो लेकर गया हेमेटोपल्स लेकर गया था, तो उसका वन कैविटी में था, तो मैंने बस केवल उसको ओपन करके क्लीन आउट करके छोड़ दिया। तो अच्छा रिलीज करना नहीं है ना, मतलब नहीं।
देखो, अगर आप कॉम्पिटेंट हो तो रिलीज करो. कॉम्पिटेंट नहीं हो
For young girls,
तो नहीं करना.
menses just
तो नहीं
start
करना.
with those
Let her become adolescent. You see by the time when she gets married. So don't try to. It's become a fashionable thing to remove septas. आजकल every gynae doctor has got a hysteroscope और बाहर भी दिखाएंगे आपको. तरह तरह के bipolar, dipolar, laser. They will be laying out for you today. So you are experimenting. Don't experiment with the uterus. One wrong laser shot on the uterus here and there, or one wrong cut here and there, just form a bridge. When bridge forms, that bridge will never go. You found bridges there, no?
Yes, sir.
This is the previous septums only.
So it was done by a good.
I'm telling you.
Yeah.
I'm telling you. I may not be good, but I've given you my score sheet. After seeing my score sheet, how the people walk out from there.
So what advice can we give to this patient?
Nothing you can give. But I think only one thing here. In case between the two septas, endometrium is triple layer,
Yes.
she's got a good chance. Such cases के अंदर remove septas and PRP works here pretty well.
We have done
PRP works here. Endometrial PRP. It works.
endometrial PRP.
That's the only option we have.
Okay.
But
Or,
this is-
or else we have to go for surrogacy.
Obviously, yes.
Already the embryos are stored.
But I'm saying that this is an iatrogenic complication and you brought out done by the best. Only best people have my score sheet. 8 people have told you. Dialysis, sepsis, deaths. So don't touch. Don't touch. Uterus should be very well preserved in every woman. जैसे बोला मेट्रोप्लास्टी कह रही थी, मैंने बोला मेट्रोप्लास्टी क्यों कर रही है, बिना मतलब मेट्रोप्लास्टी की जा रही है. आई एम आस्किंग हर द यूट्राइन वॉल्यूम, शी डजंट नो द यूट्राइन वॉल्यूम. आई एम आस्किंग हर यूट्राइन dimensions, she doesn't know. Uterus small and she wants to do metroplasty because we want to help the patient. So never do. Never do.
So regarding endometrial hyperplasia, severe PCOS with endometrial hyperplasia.
Yeah.
That also we are having one patient.
You are a veteran. You know, actually know the problems.
Yes.
You actually know the problems. Polypoidal endometrium, just can't do anything about it.
So,
I'm sweating, I don't know what to do. And the worst part is that the moment you develop endometrium becomes polypoidal, you do a surgery, it'll reform.
yes.
Within 4 weeks, it'll reform again. So I think just put a marina, and leave them for 6 months and pray for the best. Thin